Hello, welcome to Chapter 6, Stress, Burnout, and Compassion Fatigue. Within this lecture, we will identify the stages associated with stress, as well as common stressors and methods used to control stress. We will identify characteristics associated with burnout. The chapter lecture will also describe substance abuse and list methods for intervention. Internal stressors include a person's emotions and sensitivities. External stressors may include limited time schedules and large workloads. Environmental stressors may be as simple as hot or cold weather and complex noises. Here is a common list of physical manifestations of stress. Stress comes in two forms: positive or good stress, and negative or bad stress. Positive stress is the body's natural ability to learn how to cope with stress. Good stress produces satisfaction and relief once the action or actions causing the stress are over. Good stress can result in an overly energized person who eventually becomes overworked, leading to exhaustion. If positive stress continues for an unreasonable amount of time, it can turn into a negative stressor and affect the person negatively. Bad stress affects you physically and can make individuals respond in an unusual manner or normal situations. 3 factors affect good and bad stress: choice, control, and consequences. An individual chooses to be involved in a project and chooses to have good stress associated with the project. A busy clinic can add stress to each team member's workload. However, if a team can come up with a plan to overcome, then each member's stress level will decrease. This would be an example of control. For consequence, a patient might be diagnosed with cancer, in which death is a likely outcome at some point of the patient's future. However, if a patient were to die under anesthesia, the consequence of death would produce more stress. The body automatically responds to stress mentally and physically. Stage 1, or alarm, increases the breathing rate, blood sugar levels, adrenal gland secretion, cortisone production, and perspiration. Some abnormal outcomes are increases in blood pressure and digestive disorders. If stage 1 continues, the body learns to adapt to the conditions and tries to compensate for abnormalities, resulting in stage 2, adaptation. After a prolonged period, the body adapts and becomes exhausted, or stage 3, resulting in burnout, fatigue, and eventually stage 4, death. During stressful situations, neurotransmitters in the brain are called on and can be oversecreted. Overproduction of neurotransmitters can cause anxiety, anger, and depression. After prolonged release, a person is no longer able to cope with normal stressors. This is when many turn to drugs or alcohol to try to eliminate the stress. It is not known how personality affects stress, whether it is learned or genetic. However, personalities are grouped into 2 types. Type A are stress-prone individuals who are at higher risk of heart disease and hypertension. Type B are often control and compartmentalize the stress and rarely let others know how they are suffering. Life event stressors can include death, divorce, retirement, pregnancy, financial difficulties, and holidays. The list of life event stressors that can affect an individual is endless, and each person will respond to different situations. In veterinary medicine, environmental stressors include noise levels, alarms, equipment, and inventory. For instance, inventory shortages can be a stress to doctors, who may feel that supplies are always limited, preventing them from practicing the medicine they want. Team members who lack both self-confidence and self-esteem may have a harder time educating and talking to clients, as well as being successful in their personal lives. Difficult clients can take a toll on employees. Euthanasias may require the team to cater to every stage and emotion of grief of the client. Whether the client is angry, financially unable to provide care, elderly, or know-it-alls, team members must realize that stress can be eliminated if time, patience, and pre-planning is utilized. Many technicians and veterinarians enter the profession with the understanding of low pay and long hours, but years of unappreciated work eventually have a compounding effect. Job satisfaction and dedication can decrease stress again. Long hours must be capped to prevent burnout. Cope with stress by eating healthy, exercising regularly, and sleeping well. Mental changes and activities can be initiated to reduce the effects of stress. Friends, family, and coworkers can be exceptional listeners for someone who needs to vent. Once feelings are released, the stress level decreases. Talking with coworkers may not only alleviate stress, but also produce solutions to reduce stress as well. Thinking and planning ahead allow various scenarios to be considered, good and bad, which may become realities at work or home. One cannot prevent the unexpected from happening. However, visualizing what is possible can provide a comfortable framework from which to respond. Substance abusers may use the drug or alcohol intermittently or on a regular basis. Either type of user may develop substance dependence. Substance dependence is indicated by symptoms of tolerance to the effects of the drug and symptoms of withdrawal without the drug. Stress has long been recognized as one of the most powerful triggers for drug and alcohol cravings and abuse. Once a user becomes dependent on a substance, he or she continues to use it regardless of the consequences. This is when individuals lose their families and jobs. The use of substance has now become an addiction. Some risk factors for addiction have been determined and are listed here. Individuals in the healthcare industry have a higher percentage of becoming dependent on substances because of the availability and ease of access. It is important to intervene to protect clients and other team members. The practice may be at risk for malpractice suits because the impaired team member will make poor judgments. Those convicted of drug abuse can have their licenses revoked, which can prevent the license from ever being renewed. Intervention, although risky, can save a person's career and their life. A drug intervention is a process that helps a drug addict recognize the extent of his or her problem. It is through a non-judgmental, non-critical, systematic drug intervention process that the individuals are able to see their own lifestyle choices. When they truly understand the impact their alcohol dependence or drug addiction has on others, they may begin to see that they are hurting those around them. Intervention is imperative. If a veterinarian or credentialed veterinary technician chooses not to accept help, then assistance must be obtained from the State Board of Veterinary Medicine to remove the license. If a team member who is not licensed is the addict, he or she must be terminated to protect the integrity of the practice and the safety of fellow team members and patients. Veterinarians and veterinary technicians are generally a very dedicated group and will work until the bitter end to ensure patients and clients are taken care of. But in order to prevent burnout, they need to first take care of themselves. There are physical and behavioral symptoms of burnout. Burnout victims hate to go to work. They have lost the enthusiasm and passion that drove them into the veterinary profession. Often, the one suffering from burnout is the last person to identify and admit that burnout has occurred. Knowing the goals of the practice can also help prevent employee burnout. Employees that show up to get the job done and leave are at a higher risk for burnout than those who want to help the practice grow. However, team members must know how to help the practice reach its goal. The difference between burnout and compassion fatigue is that burnout vanishes when a team member leaves the practice and enters another practice. Their excitement and drive for the profession returns. With compassion fatigue, one must leave the profession to be cured. It can be described as the cost of caring for others in emotional need, and it is found in many healthcare settings. Compassion fatigue can hurt veterinary professionals, especially those with past history of abuse. These team members may gravitate towards animals due to past abuse by other people. The team member gets emotionally attached to their patients and are affected if any negative thing occurs to that animal. Team members will give all to their patients, their jobs, and to work, putting the cause ahead of themselves. It is the exact dedication that can subject them to onset of compassion fatigue. Symptoms of compassion fatigue can look different, but are all included in this slide. Compassion fatigue affects the individual with job dissatisfaction, causes communication breakdown with coworkers, may affect relationships at home due to anxiety and depression. Teams can be affected if the person struggling with compassion fatigue calls out or is late, which affects the clients in the practice and the patients. Think of the 4 R's when you think of compassion fatigue. When feeling out of control, overwhelmed, depressed, or hopeless, seek professional help from someone experienced in compassion fatigue. There is no shame in seeking help with these emotional situations that team members are expected to deal with on a daily basis. And this concludes the lecture for Chapter 6.